And today what I want to focus on specifically is the different types of type 2 medications. We're going to go over some of the main ones that you're focused on or you're currently taking and kind of talk about some of the specifics of these medications and what they're doing and unfortunately what they're not really doing to help you with your diabetic condition. So the first one I'm going to bring up here, probably one of the most common ones that most of you have taken or are currently taking right now. This is called metformin. Now, metformin essentially is what we call the entry medication. When you get diagnosed with type 2 diabetes, this is the first medication that most, if not all, type 2 diabetics are given as their first entry-level medication. Now, typically you're going to be given somewhere between about 500 milligrams to 1,000 milligrams. This is going to be 1 to 2 times a day. 1 time a day or twice a day you're going to be taking this. So maybe in the initial 500 milligrams twice a day, 500 milligrams once a day. And that's typically for someone who has a high blood sugar, but they're not massive numbers, say 200, 300, 400 plus when you get diagnosed. Essentially what this medication is doing, there's 2 key components that it's doing in your body. The first one is when your food comes into your gut, the goal is to reduce the output of the glucose or sugar into your bloodstream. So when you eat foods like candy, cupcakes, brownies, ice cream, it gets into your gut quickly and then it's released quickly at high levels. So think of like fire hose of glucose going into your bloodstream. That puts a lot of stress on your body and your body to remove that sugar from your bloodstream as quickly as possible, and a lot of stress on your tissues as well. So what metformin does is it starts to slow down the release of that sugar. So when you're eating, even if you don't stop eating those types of foods, it's going to try to slow down that release. So maybe a smaller fire hose, and that will help your body to remove those sugars at a quicker pace, which is why you start to see your sugars dropping with metformin. The second thing that it does is it stops something called gluconeogenesis. Now, I don't want to use too big of words here for you, but what that means is, let's break that word down. Glucose is sugar, neo means new. So it's your body's ability to produce its own sugar, and that happens in your liver. Now, that's an important function because if you're not eating food, well, your brain is constantly looking for sugar, your heart, your gut, your organs are looking for the sugar because it's its fuel source. And if you don't have enough fuel, well, those organs will stop working. So your liver's job is to produce this to make sure that your sugars are in a stabilized area when you're sleeping or when there's time lapses when you're not eating your food. So that's a very important component, and if you do this for a long time, it can start to really disrupt liver function, which we know that the liver is heavily involved in blood sugar regulation. We can talk about that on a later video. The second common medication that people take are glipizide, glimepiride, right? I don't know who makes up these medications names, but they should make them easier. But essentially what these are called, secretagogues. So they tell your pancreas to produce excessive insulin. So they're forcing increased amounts of insulin into your body. Now, the reason why that's important is because insulin is needed to push the sugars into your cells. So the goal is, and that mindset is, if we increase the amount of insulin production, it's going to push more of those sugars in, and that's why we start to see a decrease in blood sugar function or blood sugars inside the body. So again, these medications work. They lower your sugars, which they're supposed to be doing, but it's just not fixing the long-term impacts of that problem there. We have 2 main ones that we typically see. These are your entry level. So as you max out your metformin, which is usually about 1,000 milligrams twice a day, then they're going to go to a second medication that's going to be oftentimes glipizide, glimepiride. It could be other ones as well that are out there, things like Januvia, Repatha. There's just so many other types of medications that are being used on a regular basis. Now, over time, as you continue taking these oral medications, eventually you're going to get to a place where they're going to put you on insulin. What I always say is all roads lead to insulin. Why is that? Because eventually, when enough of the problem has occurred, When these other medications no longer work, insulin is your only option. And trust me, insulin does a good job. For those of you who have ever had to go into a hospital setting because your sugars were so high, what did they give you in the hospital? Insulin. Immediately, they don't mess around. They're going to immediately give you insulin, even if you weren't even taking insulin before. Because insulin does a rapid change, right? Remember, high amounts of insulin in the body is going to push these sugars into your cells, which is where they belong, very rapidly. But the problem with this is that, again, it doesn't impact what's really going on. See, these medications you're taking will help lower your sugars for a period of time until your problem persists. Remember that type 2 diabetes is not a blood sugar problem, it is a cell problem. And if you don't identify what is causing damage to your cells, then eventually the need for more medication occurs. And that's why when you're a diabetic or have type 2 diabetes and your doctor is increasing your medications, that is a true indication right then and there that your diabetes is getting worse. So unless you're just eating horrific, which again, most of the individuals that I meet with are not doing that. If you're trying to do the right things, if you're trying to exercise in some sort of regularity, if you're eating the right types of foods, I mean, not perfect, but you're doing the best you can do. If you're trying to keep your weight down, these are all things you should be doing no matter what. So I'm not here to change that for you and say that you shouldn't be doing that. That should be happening. But if you're doing those things and you're continually taking more and more and more medication, increasing dosages, that is a true indication that you're getting worse. It's not that you're doing anything wrong, your body is getting worse. And if that's happening to you, it's because you haven't identified the specific problem that is going on for you. So some of those mechanisms that I've spoke about in other videos that you can go back and watch, like the exercise, weight gain, or the food situation, your weight loss situation, those should be happening. But if you're doing those things and your sugars are continuing to rise and you're having to take more and more medications, there's a deeper problem going on that needs to be identified. And so unfortunately, with this type of model that you're currently doing, it doesn't address that specific complication, because the focus of these medications is not to fix your cells. The focus is not to help you reverse your diabetes. The focus is one thing and one thing only, to try to lower your sugars. And again, if your focus is only to try to lower sugars, your diabetes will progress. It is not going to fix this. I cannot stress this enough, that I know you've been told for so many years, those of you who are dealing with diabetes for 10, 20 plus years, that you need to focus only on your sugars. Of course, you need to identify where your sugars are, but what I mean by focus is if you're only doing things to try to lower your sugars, you will not reverse your diabetes. And this is the exact reason why when you look at individuals who've been dealing with diabetes for a period of time, they're not just taking one medication or two medications, they're taking all three. Do you guys see that? I want you to understand, for those of you who have just been diagnosed with diabetes that are watching this right now and you're only taking metformin, when they bring on a different medication, you don't stop taking metformin. You're adding this on. It's one, then two, then three. You keep on adding medications. One doesn't go away. So you stay with the original dosages and you're just increasing. This is a true indication you are getting sicker. So hopefully this is going to give you some more insights to more about what this medication is doing in your body, the mechanisms that are involved, but more importantly, how they're not fixing your problem. Now, again, don't just stop your medication. That's not what I'm referring to here. I'm just trying to give you more insights to what you're currently doing and what needs to be done. So if you haven't found or you haven't identified specifically what your problems are, you need to seek somebody out to help you find and identify what your problems are. If it's someone like myself or some other individual. And if you go back to your doctor and you ask them, hey doc, can you identify for me specifically what is causing my diabetes? What is causing my cellular damage? If they can't give you that answer because they haven't identified that for you, you're missing the boat and your diabetes will progress and you will get worse over time. The big picture today I want you to understand is taking medication alone, lifestyle alone, with the medication, those things will not fix your diabetes. You have to identify your cause of your cellular damage. And when you find out that and you implement those things with your lifestyle, you'll start seeing these medications going away. Yes, we see this every day in my practice, individuals getting rid of these medications. medications, getting off the insulin, no longer needing it, getting off the other medications as well, and eventually metformin, and we can evaluate them and they have a normal A1C, 5.2 to 5.6 with all medication gone. This is a possibility and it can happen to you as well. Hope this information was worth it for you guys today, and please make sure you join us next week for our next educational video. Take care.